My study was about the outcomes of retinal detachment surgery in patients with phakic IL. I've nil financial disclosures. So, implantable Collamer lenses have been found to be effective and safe for the correction of moderate to high myopia. Frequency of rhegmatogenous retinal detachment increases with the increasing severity of myopia and also with any intraocular procedures. RRD is part of a natural course of complication, including premature vitreous liquefaction, posterior vitreous detachment, high axial length associated with high myopia and peripheral retinal degeneration. The post-operative complications rarely occur after ICL implantation, although cataract formation, glaucoma, and pigment dispersion, toric ICL rotations have been reported. The aims and objectives. The aim was to determine the risk factors and analyze the treatment outcomes in eyes with rhegmatogenous retinal detachment following phakic IOL implantation. The primary objective was to determine the visual outcome. The secondary outcomes were the mean number of surgery for the retinal detachment, removal of ICL, and the complications post-operatively. It's a single-center retrospective observational study. Inclusion criteria includes all patients aged over the age of 18 years, all patients undergoing retinal detachment surgery with phakic intraocular lens at our center, and patients with minimum of 6 months of follow-up. The exclusion criteria included any patient having any other ophthalmic diseases other than refractive error. The medical records of consecutive patients who underwent phakic ICL at a center were reviewed between April 2014 to March 2020. Best corrected visual acuity, anti-resectment evaluation, intraocular pressure, history of prophylactic laser photocoagulation, duration of development of retinal detachment post ICL implantation, and the details of the surgical management were analyzed. Data was entered in MS Excel, analyzed using the SPSS22 version software. P-value less than 0.05 was considered as statistically significant. Coming on to the results, 12 eyes of 10 patients had rhegmatogenous RD in 698 patients with phakic ICL implantation. All the patients were male with a mean age of 36 years. The mean pre-operative refractive error was 14 diopters, and the post-ICL refractive error was around 1.8 diopter. Prophylactic laser photocoagulation was done in 10 patients. The average duration of presentation of rhegmatogenous RD post phakic ICL implantation was quite variable. The mean duration was about 27 months, and there was no statistically significant relationship between the duration of development of RD and the phakic ICL implantation. The mean BCV at presentation was 1.0454 logMAR units, and the mean post-operative BCV at 4 weeks and at the final follow-up were 0.5375 logMAR and 0.592 logMAR units respectively. 2 patients required secondary surgery, one of whom had a temporal RD with HST previously managed with an encircling barrage buckle, had to undergo a second procedure of pars plana vitrectomy with silicone oil insertion due to an unsupported or missed break. And one patient, there were open breaks noted during silicone oil removal, had to be managed with a repeat VR surgery with 3 silicone oil insertion. Glaucoma was the most common complication noted, and all the patients were managed medically on anti-glaucoma medications, were found to be well controlled at the final follow-up. 90% of the patient had to undergo ICL explantation due to the development of posterior subcapsular cataract after a mean period of 15 to 15 months post ICL surgery. Dominic NP et al. Reported a case of in 2008 where the patient presented with RRD within 3 hours of ICL procedure, after which after 1 year of follow-up post VR surgery, and showed good functional and anatomical result. Rishi et al. Conducted a study in 2019 about retinal detachment after phakic intraocular lens implantation, in which 10 eyes developed RRD, including 4 males and 6 females. Average age was around 23 years. The mean refractive error was 12.5 diopter, and resurgery was done in 1 patient. In a similar study conducted by Martinez Castillo et al. In 2005, they found 16 eyes in 15 patients had a rhegmatogenous RD following phakic IOL implantation, and the mean age of 32 years. and a preoperative spherical equivalent of minus 17 diopters. The final success rate in the study conducted by Rishi et al. Was 100%, and the only one patient had to underwent a resurgery. Similarly, in Martinez Castillo et al. Reported anatomical success rate of 90% after a single procedure, and the final reattachment rate was 100%. Likewise, in our study, the anatomical success rate was at the final follow-up was 100%, and the resurgery rate was 16%. In conclusion, we concluded that even though the patient required multiple surgeries, finally the anatomical detachment was achieved in all the patients, and early surgical intervention for the retinal detachment is an important factor for a good visual outcome and anatomical prognosis. All patients were doing well at the final follow-up. These are my references. Thank you.
Thank you, Dr. Manjushree, for this presentation. I wanted to ask you, did you grade the PVR changes in all these patients? Because, if it's an advanced PVR, the success rates are less. So you said you had one case which was redetached. So what were the PVR changes? Or did they all present in early,
It
the early
was not
PVR?
that
Because that is
long.
very important.
It was
When
not
you
a
grade
longer
the
follow-up, so we did not have.
No, this is the pre-op assessment. This is a post-op also, but you're saying most of your retina settled, but pre-op you have to assess the PVR grading.
Assessment all was done, but
But
I
you have
think
not mentioned that in your study, which is also an important factor. If that had been mentioned, it would have been
yes.
nice.
What are the factors? What is the difference in the presentation of RD in this phakic ICL patient with respect to normal patients? When normally who present with RD? Was there any difference, like you noted?
No, ma'am. As such, there was no difference. But since they were already operated,
Achha,
I
yeah. But the case sheets must be having, if something is there, like
nothing out of ordinary. There was nothing.
all were total RDs.
Some were temporal RDs, only superior RDs. Some very high myopes only. They had total RD. Mostly subtotal and temporal RDs were there.
And in terms of the management of the retinal detachment, is there any difference between the approach to management in otherwise phakic eyes versus eyes that have an ICL, or is it just like any other detachment had the patient not had an ICL?
So, in hands of experienced surgeon, I don't think there will be any different. But for newcomers and newer surgeons, I think we have to be very careful. The retina will be thinner. We cannot. There will be there could be complication at any stages.
So is that because they are myopic, or is it because of the fact that they've had an ICL? Does the presence
Mostly
of an
high
ICL
myopic.
modify anything?
Mostly the high myopic cases will be there.